everything that is in it should be labeled there. You should have
Chucks.
one or two or three chucks.
Puppy pads. One on top of the mother, one under the legs of the mother, one.
Should have 2 to 4 little small blankets.
Are those for the baby?
A booger sucker.
Oh, sorry.
Gonna need that. 1 or 2 bags.
For wasted
One
placenta.
one big one for the placenta, and then you have in these kits they have a white bag just for your trash. One large feminine hygiene pad.
Circle pad.
2 cord clamps.
7 and 3.
Just a few pieces of gauze, depending on the kit. And then you should also have at least 2, what kind of wipes? Benziconium
Are they?
Benziconium wipes.
wipes.
Benziconium.
2 BZKs and 2 alcohols.
Don't get it mixed up.
Do not get them mixed up.
I like that type.
And then your butcher's gown or your spacesuit. As good as it gets for these things.
Don't forget your
So you will see crowning. The head. Where does the term come from? It's going to be showing. So the hoo-ha is going to be all busted and getting wide and open.
And then you see a little
Don't worry, chicken, you'll never see that. Okay?
busted down.
So if you see that, that was not her hair, that's the baby's.
If it looks like there's a sacrifice, that's what I mean. If it looks like you can see the hair but can't touch it, sack still intact. Pinch and poo. Do you do that when it's crowning? Pinch and poo?
You can't.
You can.
Okay, so what do you do if you have cord presentation?
Oh, you have to walk in the air like this. You have to put your hand like in there, get a good grip, and walk in the air like
This
that.
motherfucker.
Really?
Unless it's barely poking out, and make sure no one sees.
That's rude, Tion.
And then-
No, it's okay, it's okay, it's okay. Don't worry about it.
No fuck, see that shit?
No, it's okay. I got it from her.
Whenever you use your and then their phone fell.
Tion, you can use my water bottle.
No, I got it. We're good. Go ahead.
Alright, you can use my water bottle. Are you sure? Okay.
I got it.
Go ahead. Breach.
Push it back in.
According to medical control, you can ask if it can be worn like that.
Don't you have to do C-section because
Yeah, that's dangerous.
Well,
Hips
if
may
once
not be
they're
too
out, I mean, technically,
You can take her out.
What is it choke? Can I make a choke on the
Because you
face?
never know if they're built to wear his doctor on his neck, so you have to pull it.
You have to twist.
technically it could be born if both feet are out.
Yeah, that's what I was
But
gonna say.
it depends on the.
On the, you said on the
You got a
length of
little
the.
tiny Asian
Yeah.
lady,
No way.
her pelvis is massive.
You said,
So what if you get,
Oh, that's bad.
take that ass to the hospital?
I mean, maybe they're flexible.
Babies are flexible. You said.
babies are flexible.
But the mom is not as much.
It's definitely gonna be a stretcher, yeah.
You might get a tear.
Oh, it's just nasty.
No, you.
You alright, buddy?
People are tear.
You might end up with just a high five.
Oh yeah, what do you do in that situation?
Push it back in.
You leave, you take it to transport?
Immediate transport.
Immediate transport.
C-section.
What do you push his hand back in and you do like, hey,
The only time you can push it in is no one sees and it's just a little bit of the umbilical cord.
Well,
You're not supposed
once the cord, or once any part has made it far enough out to sea, there's no,
Going
can't
back.
really push that back. Okay? So we're going to prep the area, right?
Sterile.
So you have your regular PPEs on. You're gonna grab a BCK wipe. From the top, down. Trash.
Not bottom up.
From the top, down the other side, trash.
Oh, down both sides?
Okay, we're trying to make sure the area is clean. We're prepping the area. Now, once that is done, you can pull out your sterile gloves and put on your sterile gloves. And we have done the cleaning. Now we are at the point where we actually are touching our patient, right? So we're gonna go into space suit up. Put your sterile gloves on, and now you are going to ask the mother to lift her hips up so you can tuck this in. And then you're gonna get the other one. I prefer big then little, and then have it go out like that. Because with the amount of fluid that comes out, if this one becomes saturated, you can just take it, fold it up, and set it aside. You still have a nice, clean, dry surface. Okay. Now you are going to take these guys, open it up. One is going to go over the abdomen, and then one is going to go over each leg. Okay, so unfold them and put them there. Once that has been done correctly, then we're just going to take them, grab them, and get rid of them because they're kind of in the way. So you've used 3, that leaves you with 1 in this particular kit. Okay, once it's draped off, you're ready to go. Okay. So once you are preparing for delivery, you're going to put a little bit of pressure on the top of the head. Right? I'm gonna make sure I'm in the right spot here. So we're putting her in the position that got her in this position. Usually. That's your, that freaky stuff. Over here, over you can't drape the mother. Okay, apply pressure to the mother's perineum. Now, if you were living in another country where they do things differently, you would actually be doing a perineal massage. Now, here in America, they are also doing that. Oh, yeah, I forgot. We need our gown. So this is what the gown looks like in your kits. Perineal massage. In some parts of the world, they'll actually have you sit there and you'll just rub the perineum.
Gooch.
And in the hospital setting, nurses will do this also. They'll just sit there and they're just going to rub the perineum because that gets the tissue to relax and stretch. That keeps them from tearing. EMTs don't do that though. If you do that, you can get arrested. Don't play with the taint. Chicken.
Sometimes the gooch.
Okay? Now, you're going to apply a small amount of pressure to the top of the head, and this is going to prevent an explosive birth. An explosive birth is going to tear the perineum. They become shooting out, that big fat head is going to rip the vagina open. If need be, you're going to be taking a look. If you need to tear the amniotic sac, then you're going to go ahead and grab, twist, pinch, pull, tear. If, because it's slimy, you can't, get one of your pieces of gauze and use that. Then you'll have traction. Okay. And then you're going to note the color and the odor of the fluid.
Should be clear, maybe a yellowish.
Had no order.
Should.
Well,
Can't smell it.
if you see brown, forgot what it's called, but.
Yeah, if you
Shat
see
sack.
brown, what is that?
Poop.
Meconium staining.
Meconium staining.
Meconium staining.
Shat in the sack.
So if you see that, what do you know needs to happen?
She needs to get burned and poop.
You have to be sure to suction it off first.
Oh, yeah.
Make sure you clear that airway as quick as possible.
You want nothing to shake like
Oh, and you have to clear away when the baby's out, not when it's
Yeah.
popping out.
Not to know.
So you're gonna have the mother push. Now, as the baby, ordinarily the head will be facing down, and that's just an anatomical thing. And then as soon as the head breaks out, the head will begin to rotate from one side to the other.
Oh, okay.
Okay? So as it rotates out, now you can see the neck. So if you see the neck and you have cord wrapped around the neck, what do?
You put 3 fingers in between the cord and you try to put it over their head.
Okay. So your goal is to try to pull on the cord enough to get enough material that you can roll it off the head.
Airway obstruction. No.
Now, if you can't, what happens?
Maybe
Yeah,
try.
the cord wrapped around his neck, it could be yanked, and the placenta might come out with it.
Okay. So if you can't, this is there and you're trying to pull both sides to get some laxity, but no, there's just nothing coming. So this patient is stuck like this.
Don't you clamp it?
You're gonna go ahead and wiggle your fingers underneath it to try to get as much of it free as possible. And then you're gonna place one cord clamp here and one cord clamp here,
I'm gonna cut.
and you're gonna make your cut in the middle.
Oh,
Then you can finish the delivery.
okay.
But you also have to keep in mind, if you cut the cord, you're cutting their life support.
So you gotta act fast.
Make you breathe.
So you need to deliver them and get them breathing as quickly as possible.
Probably resuscitate.
So as it comes out, so if you did do that, then great, fine, wonderful, awesome. If not, if you don't have to worry about that, then the next step you're gonna have is the shoulders. Depending on the baby, the lower shoulder may have come out first, or the upper shoulder may have come out first. So the head will either be wanting to come down or come up. At any rate, you're just going to assist and help with the other shoulder clearing. So once that other shoulder clears, what's gonna happen?
You sit on your hands.
You're gonna use your 2 fingers and grab it on there.
Okay, you can do that.
Guide it out a little bit.
Well, what's gonna happen once the shoulder's clear?
Oh,
Oh.
As soon as the shoulder's clear, that releases that space, and as she's pushing,
pussy pressure. It's a Friday night, right?
so then once that happens, you're just gonna go ahead and guide the baby out. You're gonna wanna keep the baby at the level of the mom. If the baby is covered in cheese, and it's hard to hold on to the baby, and you drop the baby, what happens?
Fake a seizure
You
the
better drop
best
the
that you
ground, fake
can.
seizure, because you're
And
screwed.
you didn't remember it after. Because you don't remember seizure.
So keep the baby at the level of the mom's heart. If you need to, you do have the option of just setting the baby here on the mom's upper belly or chest,
On the blanket, that should be.
as long as you have enough of this there.
Okay.
Yeah, because there should still be the white bedding. Okay? So you can lay them on the sterile field. Now, what do we do next?
7 and 3. I'll wrap the baby.
You,
Oh, no,
mouth
you
to
wrap the head.
nose, mouth to
Airway.
nose.
Wrap the head.
Flick the
Airway.
Oh.
You
You're
gotta
gonna grab your
stimulate
bulb
breathing.
syringe. You're going to arm it, squeeze in the
first.
mouth. Partner, paramedic, fireman, parents,
The mom.
mother-in-law. Whoever is the most annoying person, clean that stuff out of the mouth and flick it on them. Then you can go to the nose. You can do one side, you can do the other. Go back and forth a couple times if you need to. Okay? Now, you know that it's called the Nick Roberts maneuver? What is that?
Mother's legs to and pretty much
Applies.
So if as the head is presenting and she's having some difficulties,
It's not coming out.
this is where you have her grab her legs behind the knees, or in front of the knees, and pull and then push.
So like cannonball and then push?
That's the
It's
Mick
cannonball.
Roberts maneuver.
Nick Roberts, cannonball.
Then you can make sure that you use sister's body, supporting the head and keeping the body at the level of the perineum or at the chest. Then you, so I like how it says, keep the baby at the level of the perineum, so keep it down there, but then put it on the abdomen. Okay, well, you just contradicted yourself.
So,
Wipe the newborn's mouth and nose. It just says wipe, no use suction. You can use one of the gauze squares, but I would not recommend using a gauze square on a neonate. Yeah, the
Very
material on these gauzes, it's like sandpaper, and they literally have baby butt skin. Very sensitive, very fragile. This can actually shred off tissue. So I wouldn't recommend using the 4x4 that's in there, but you do have an extra one of these. So use this to dry the face and dry the head. Okay, now we're at the point where it's time to cut the cord, right?
Yep.
So what do we do?
7,
3 inches away from the baby and 7 inches on.
Sure about that?
No, opposite. What you said.
7 and 3.
7,
7 and then 3. And then if
7, and then I'm gonna go
17.
3 more. So I'm gonna go here and here. Open your packs and actually put the clamp on. Happen to have hold under it.
7 and 3. There's my whole hand. 7 here, 7 here, and 3 on here.
Got your 3?
That's a 1.
Yeah.
No.
For you.
That's a 1. When you clamp the cord,
Yeah,
you're gonna put the cord in the middle of the clamp down.
Middle of the clamp, not the end of the middle.
Don't put it all the way in here.
You might break it and it doesn't get a good seal.
You don't get a even seal. Okay? So middle of the clamp. Put your clamps in place where they need to be.
7 and 3.
Then you're gonna take your alcohol wipe and you're gonna wipe this and cut it. You will be, at least in the kits, for demonstration purposes, you will have umbilical cord cutter. The kids come with a scalpel. They do not want EMTs. They do not trust EMTs with a scalpel blade. So they want every company to go into their ambulances and take out the scalpel and put in one of these. These are only a few bucks a piece. That means the company has to buy them. So kind of like a little cigar cutter.
Yeah.
That is your cord clamp cutter. That is what you're supposed to use. Now, if any of you have never seen a scalpel,
Looks like an exacto.
it's like a hobby knife. One here in the package. This is what they look like in the package. This is what the blade looks like out of the package.
Don't pass it down.
So that's the one in the package. Don't take it out of the package. Here, let me fix this one.
nobody cuts themselves?
Oh, is it 6 inches?
That should dull it enough.
Yeah.
I'm sure one of you fucktards is probably still gonna hurt yourself with it.
Oh, daddy, come on.
I'm surprised you pass around needles.
Now,
every
what
time.
is nice about that scalpel is for you idiots, there's a little ruler built onto the handle.
Oh, 7
Oh, yeah, I saw that, I saw that, I saw that, I saw that.
I saw that. Apparently he saw that. Like several times he saw that.
Yeah, I want to put it on.
7 and 3.
But it's only 6 inches.
Still more than you're used to. Twice.
Nah. Yeah.
Strap-ons don't count, chicken.
Oh,
Okay, so you'll cut the cord. If you don't have a whole lot of space, make sure that when you grab the blade, put the blade underneath and pull up towards you, okay? You're gonna flick the blade towards you.
Quick blade. This one.
If you have scissors, you're just gonna cut. But if you have a scalpel, put the blade underneath and pull it towards you. Do not ever push the blade through, because the umbilical cord is very tough. It cuts pretty easy with a brand new scalpel, but it is kind of tough. So you may have to wiggle the knife a little bit, but if you break through and slice the patient, that's bad. Don't do that. Okay? Big. So we've already cleared the airway. Making note of any respiratory issues. So this one says 4 and 6. We know it to be what?
7 and 3.
3 and
3. Okay? Cut the umbilical cord, and then you're going to dry and wrap the baby. So once you cut the cord is cut. Now you're going to dry and wrap the baby. I did not get, or somebody actually took it out.
The wrap.
Every kit should have a blanket, a baby blanket. I brought in an actual children's blanket and cut it up so that every kit has an actual blanket. Because the little one that comes with the kit, the paper one that comes with the kit, is garbage. The second it gets wet, it's the same material as these things.
Oh,
Second they get wet, they just disintegrate.
they're like toilet paper.
They're very useless. Yeah, that toilet paper you could read a newspaper through.
Oh, yeah. Cotton now.
So this is actually a pillowcase, but you're gonna wrap the baby. So you'll take the blanket, you'll bring it out, make sure that you are supporting the baby's head. And you're going to wrap the baby after cleaning it. And then you're going to say that you are going to cover the head to make sure that you don't lose any heat. If your kid has a beanie, then you're going to apply a beanie.
Okay.
Now you're going to hand this off to your partner.
You take this pierce like that.
But I might ask you to give me an APGAR for the 1 minute. So if your baby is blue trunk, blue extremities, weak crying, and heart rate of 108.
3.
Each card.
Is it 3?
So
Because
one
you
away.
said extremities blue, that's 1, and then
Trunk
we cry,
blue.
that's 1, that's 2, and then the slope below 108 or above?
It's about
Above 108, then that's 4.
4.
It's a long nap.
It's not a lot of math.
It's not a
There's basic, there's fucking 1, 2, and 3.
I was just kidding, I was just kidding.
Actually, it's just 1s and 2s, yeah. 0, 1, and 2.
Muscle tube?
Welcome Gwenda.
What is the muscle tone mean?
You didn't say put it on, you used that.
Their activity.
Oh, like the movement.
So you're either gonna have one that is kicking and screaming, or you're gonna have some that really aren't moving hardly at all.
That's not a good sign.
The ones that typically are not moving, those are the ones that are a problem with your alcohol
recording, and
or drugs.
Narcotic.
and I was just like,
And
all
then
of us were like,
the
what?
reflex irritability, that's like crying, how much they're crying.
How much they're moving.
Oh, that's also moving? Yeah.
So if you're touching the arm, or they pull in, or they
Oh, do
respond
they have
to you.
like a reflex to you? So, yeah. Okay, thank you. That's all I had questions. Oh, go up, by all means, but there you go. Lead it on the back.
So now you are going back to the mother. At this point,
Placenta.
you gotta do the installation.
Your placenta here.
So how are you gonna know if the placenta is coming?
You need to do the fundal massage.
You might need to, but not quite yet, usually.
Yes.
If
The
she
cord's
feels like she
being
needs to
longer.
push
I mean,
again?
the cord's coming.
If the cord, remember, you already cut the cord, so you're gonna have this piece sticking out. If the cord is starting to grow, it's not because it's got fertilized. That's because the uterus is starting to contract and letting
umbrella's closing.
letting the cord come down.
Umbrella's closing, kind of pulled out.
So what you're gonna wanna do is you're gonna wanna get into your box, you're gonna get your clear bag. Gonna open it up. And you're gonna set it here to catch that. So this may take how long?
Give her 10 minutes?
5 seconds.
5 minutes?
4 seconds.
Almost at like 2 minutes.
1 minute. How
You
long
give,
does
you
it
give it
take?
10 to 15
It
minutes.
depends on, it just depends until it all comes out. You can't really tell.
You
How
give
hard
her 10
she
to 15
pushing?
minutes on sync. No, it's not that long.
Don't you tell her to push though? Like another.
Yeah. Because she's still gonna have to deliver this.
Yeah.
So
Yeah.
contractions should start to happen again.
Oh, okay. So same thing as the baby.
Yeah.
Okay.
Then what?
And she delivers it.
Push if it's not coming out. Funnel massage.
Okay, so you're gonna have her push. If it's slow to come, you can do the funnel massage. You're just gonna take your hand above the pubic bone and you're just gonna massage. You're
On the grass
to,
patch.
trying to get that muscle to start to relax and contract.
Okay.
Okay.
Mix up some goods.
Can you start over? From the part
Like from the Oh my god.
I think it just depends on
Okay.
What's the name? Higher.
Huh?
I heard it was called like
This mother trucker.
So funnel massage.
Somehow how long-
So once this starts to come out, then you're just gonna wait and it should drop out. Now for the sake of testing, we're gonna have it deliver. We're not gonna
Wait around.
wait around.
I don't mind waiting.
Yeah, you waited this long to finally see one, huh?
Yeah. We're so hard.
Yeah,
No comment.
no comment.
I look forward to it.
But if it's been 10 minutes on scene, you get her onto your gurney and you start transport. It may take up to 30 minutes or more, your book says?
I don't know.
if that.
This book?
Okay? So once that is out, you are going to bag it. And the whole reason that we use a clear bag is so that you can see it. You're gonna take it and you're going to tie it up on the bag. It has little twist ties that help to hold the bag closed, but when you get your bag, it'll have a twist tie. Go ahead and spin it, put a twist tie on there and tie it up. Now you're going to look at it. You're gonna inspect the surface to make sure that it is intact. If any pieces are missing, you know that there's still a piece in here, which means what?
It's gonna come out.
There's still more.
Definitely, yeah. Thanks for the
It needs to come out.
rocket surgery there. What does that tell you you are gonna need to have to do?
Clean up some more.
Get another bag.
Okay, there may be some more cleanup. What else?
Possible more fundal massage.
You're
Explosion.
gonna need to do some more fundus massage. Fungus massage. What else?
That it needs to come out, so they might have to do like surgery or something to take it out.
If there's a piece still in there, if it tore away, that means there's open blood vessels.
Oh,
So you put pressure on it.
Bleeding control.
Big pressure.
You're fighting that thing way too much.
Diet starts Monday.
it's actually
Freaky
Friday.
Monday, freaky Friday.
Not sure which one to put it in.
What the fuck happened with Booty, man?
Buddha Man somehow thought I was gonna get him.
You still got me, you moved.
But daddy.
It was worth it.
Mister.
Easter. Okay, so if there is still a retained piece, that means there's gonna be a lot more bleeding. Gotta remember, you saw the pictures, the ones in the lecture.
It's all blood.
When that thing pulls away, it's just all open tissue. So on the inside of that uterus, it's like a big road rash. All open blood vessel ends. So there's going to be bleeding. The faster that uterus contracts, the less that bleeding is going to be. Because as that muscle contracts, it closes off those blood vessels. So you want that uterus that was stretched out to like this, you want it to retract down as quick as possible. That'll reduce the amount of bleeding. So once you have checked and inspected the integrity of the placenta and the cord, check for lacerations and control bleeding. So in the event that the perineum did bleed, or did tear, you'll grab some of your gauze. You're gonna apply it to the perineum. Where's the perineum?
The gooch. The taint.
The taint. Taint the vagina, taint the butt. Put your thumb there and you're gonna apply pressure.
Oh.
Okay, don't put your thumb in the butthole, Tia. Okay, don't do that. Don't finger the butthole. That's a no-go zone, okay? What you do at home is your business. And then you're gonna place OB pads or large dressings. So maybe your kit didn't come with an OB pad. What are you gonna use?
Gauze.
God.
Go.
Gauze?
What, dressing.
Take.
Oh, one of the blankets. One of the pads that we have.
The trunk.
No, because those are gonna have all kinds of nastiness all over them. So if you don't have an OB pad in your kit, what do you use?
Whatever you have.
A
the
tampon? A
Clothing.
pad?
No, you don't put nothing up there.
A pad?
I mean, if you carry pads, sure.
Something similar.
Tampon.
You do not put nothing in the vagina, chicken.
A Playtex
like a
Sport, I
pad.
don't know.
Fucking dreamer. That's what this is. But your kid did, for some reason, didn't
Oh,
get one.
ask her if she has one.
If she had one.
Right, if she has a
Well,
pad.
she shouldn't have
She
a.
won't have a pad if she's pregnant, she's not having a period.
There you go.
Ask a
No,
bystander.
no,
if they
that's
have-
kind of how it works. When you're pregnant, you don't generally have a period.
Ask a
But you
bystander if they have a
do.
pad.
Some people
That's
do.
fucking weird.
So you ask the patient. Or 50-50, yeah.
Okay, or what else can you do?
Or go
Put a towel on or
some
Or tell your
towels.
partner get you one.
Your partner's gonna have one in his butt?
Get a towel from the rig or some
Yeah,
shit.
like,
Okay, we don't carry towels in the rig.
A
Don't
blanket.
put anything, just leave it.
Just let her bleed.
Yeah.
Fuck it.
there, dude, what the fuck?
What about
Tell
her
her close her
clothes?
legs.
Her belongings.
Sure.
Okay, in emergent situations, sure. What's the right way to do it though? If you don't have an OB pad in your kit, what are you gonna use?
Vertical to the, almost like
Okay, gauze is not really good. Again, I already
Direct pressure.
told you.
Those
We're
AB
not
pads.
gonna put
Love
direct pressure on the uterus. You're not gonna fist this poor patient.
You have other pads. You could just create that.
Just take
How
direct
can you
pressure, which
create
can
an
prepare
OB
your
pad?
You get another AB pads like the ones we were using for like to fill in the voids and stuff.
Yeah, what are they called?
Are
Abdominal
the AB
pads.
pads?
Abdominal pads.
There you go.
Basically the same thing.
There you
Yeah.
go, there you go.
Okay.
Grab a couple ABD pads or even maybe a trauma dressing, which is bigger. And you're just gonna spackle it over that. And you're gonna have her close her legs to help hold it in place and to help control the bleeding.
Does the patient drop her legs at this point?
Doesn't need to, well, yeah, if they're up in the air, then yeah, definitely. Okay.
Cannonball.
Then you're gonna do a fundal massage every 5 minutes for a few minutes, until everything has stopped.
Okay.
At which point now you can take vitals on your patient,
On the mother and the baby? Or
on the
just
mother.
You can't take it from
Generally, we don't, unless you have enough personnel, we're not really interested in what the vitals are beforehand, unless there's some sort of history there. Okay. And then, once you do that, you are done with the mother. Now you're gonna come back to the baby. And when we test this, we just test it. Like we're doing just one continuous.
Just quick, get it done. Don't ask shit, do it. Chicken, don't ask questions on days, don't do that shit.
Rapid?
Yeah, chicken.
So when you do the test, don't ask no questions, like just shut the fuck up and do it. And food away. Oh, I've been awake, food in my river.
Okay? So the first one we've already done, we have dried it. We may want to reassess, check that airway again, make sure we suction in the mouth first, then the nose, mouth first, then the nose, mouth first, then the nose, mouth first, then the nose. Okay.
Nose first, mouth
Now first.
Breathing.
Vegetables.
So
Vegetables.
this maps it out pretty well. So if I tell you that your patient has a heart rate of 110,
Central cyanosis. Blow by oxygen at 10 to 15 liters per minute.
okay, so you should be able to do that. If the patient has a heart rate of 180,
We're fine.
well, what are their colors?
Should be
Huh?
pink.
So 180,
Warm.
pink and pink. And then now what's the activity?
Good crying.
Crying, moving.
Crying, motor function.
And able to retract from you if you touch them.
Well, theoretically, that's what it should be. But if the heart rate is, let's say, 62,
Slow crying, weak crying.
No crying.
then you,
Maybe blue
maybe no
extremities.
crying.
Yeah.
Body
So
pink,
maybe a
blue,
pink
blue.
trunk with blue extremities, maybe a blue and blue,
Trunk, yeah.
Yeah.
with very little activity. So what do?
CPR.
Start rubbing.
You're gonna prepare for CPR. So
Initiate CPR.
blow by, if respirations are successful.
PPV.
Blow by, if that doesn't help in a few, like 20, 30 seconds, then you go ahead and bag the patient. So get to know this well, because those are the scenarios we'll give you. And then we'll also tell you to give us your next APGAR.
Oh, give it another score.
So at 5 minute mark, we're gonna tell you that patient is pink and pink, heart rate of 122 with no crying and not a whole lot of movement.
Like 4, 5.
Where's your card?
Yeah, what was it?
Just look on your card.
It was good crying.
Pink and pink, no crying, no activity. Heart rate of
120?
120.
4. Did you say no crying? No draw, just draw away? 4.
No activity.
4.
That was 6.
Body pink.
How come his number's different than yours?
Hold on.
I think I found it.
Good, Craig?
Yeah, it was a
No
good
cry.
cry.
No cry, no activity.
That's why.
No cry.
How is respiration?
Good.
Breathing at 40.
So,
6. If it's a respiration.
Sounds
what
right?
did I tell you?
It kind of varies,
Right, huh?
it depends on.
Yeah.
Some babies
That's right.
they'll just sit there and
Yeah,
just
yeah.
look around for the first couple hours. They don't do much.
Yeah, I've heard about that.
And then others are just creepy.
Yeah.
Right?
You hear them with the shut the fuck up, baby.
So then you're gonna go through that against scenario dependent. Whatever we say to do, do. And then before you're gonna be done, you're gonna, because your baby's gonna be all wrapped up, so a lot of people forget this and fail. Make sure that you reassess the stump of the umbilical cord. You're gonna check the clamp, inspect the clamp, and make sure there's no blood seepage. If there is, direct pressure. If that doesn't stop it, add another clamp behind it. If you don't have a clamp, what do?
Shoelaces.
Shoelace.
Okay, you can use a clean new shoelace. Who carries that?
Nobody.
Yourself.
Really? You gotta keep
Oh,
that in
not
your
a
butt?
clean one, but
Tied in a knot.
Duct tape.
You can't put duct tape on a little piece of tissue.
I said tied in a knot. Use one of your twist ties.
Use one of your twist ties from your kit because you should have 2 bags. Both of those bags have a twist tie connected.
Twist. Twist tie.
You don't need both of the twist ties.
And then you just cinch it.
Okay? And that's your Obisco.